delivery infrastructure in Nigeria. And my guest this moment is Nanman Kash. You're welcome to the program.
Thank you for having me.
And you look beautiful.
Oh, thank you. And you too, you look so beautiful.
Thank you. So, Nanman, coming out of the Vox Pop, we've heard from Nigerians, it seems like we have serious concerns about the health sector. But I want to hear from you as a health practitioner. What is your idea or what's your assessment of the healthcare infrastructure and all of that in Nigeria?
Okay, thank you once more. The healthcare infrastructure of Nigeria. Well, before I even go into the infrastructure, Nigeria is blessed. And even the healthcare sector is so blessed. We have a population that is so impressive. We have a lot of women, we have young people who are energetic, we have children, and we still have women giving birth if you go to the antenatal unit. So we have a very good population that if we have a healthy population, it shows that Nigeria is going to be a highly productive country. So talking about the infrastructure of Nigeria healthcare system, well, I think COVID was the litmus test that really gave us a shocker. When COVID came, the infrastructure in the hospital wasn't really so impressive that I thought that by now the infrastructure of Nigeria healthcare should be something that we'll be happy about, because nobody could travel out. The elites were part of the casualties or people who were affected by COVID. But look at us. This is about 4 years after COVID. We still have issues with infrastructure in the Nigeria healthcare system.
Okay, we're having more of the Japa syndrome in the health sector. And this is resulting in very low number of doctors, nurses that people can access for healthcare. We also have the issue of proliferation of fake drugs, quackery, and all of that. I would like to know, these challenges, where do we go from here? How do we address it? How do we, looking at the commitment of African leaders in 2001 on the 15% allocation of their annual budgets to healthcare. Looking at what is real now, well, we are far from that 15%. What do you think we should be doing?
Okay, looking at these challenges and talking about the Japa syndrome, where healthcare workers are leaving the shores of Nigeria to go seek for better conditions or greener pastures, as we always say, is that let's look at the pulling factors and the pushing factors. What do I mean by that? Is that our healthcare workers, what is really pulling them to that side? There are things. What are the remuneration of the healthcare worker here? Example, as a nurse, how much are they paying a nurse in Nigeria and how much are they paying a nurse out there in the other countries? That could pull somebody because their remuneration is better off out there than this place. Talking of the infrastructure that we talk about, there's nothing as frustrating for a health worker like you want to do a certain procedure. A patient is looking up to you to render healthcare and you don't have what to work with. So it means that you can't even help the person and the patient might not understand. So infrastructural issues is another issue that is making some health workers to leave the shores of Nigeria. So we should look at all those things. Now, what are the things pushing some of them aside the remuneration, the infrastructure? Insecurity is another thing. Healthcare workers are being kidnapped, some were attacked on their way to work, and it's still happening. So, but out there it's not so. They honor health workers. Health workers are well treated. I spoke about the healthcare system in Nigeria, and I said we have a robust healthcare system because if you go out there, the health workers you meet out there are Nigerians. Then talking about our people going for medical tourism. They leave Nigeria, go to all those other countries. The doctors, the nurses, and the other healthcare workers mostly are Nigerians or Africans out there. That shows that we have the institutions that train our health workers well. But how do we keep these health workers to render these quality services to our people? That's a major thing. Now we're talking about the economy, the relationship between health and wealth now. If the money taken out of Nigeria to go treat our elites out there is being invested back into Nigeria, can you just imagine our healthcare system would be? It would be bigger and better. Now talking about the declaration, the 2001 Abuja declaration, where we said, where we our leaders, the African leaders converged in Abuja and all made a commitment that they'll allocate 15% of their annual budgets to healthcare. But this is 2014, about 23 years down the line.
24.
Okay, almost 24 years now.
2024.
2001, this is 2024.
Yes.
Now, nothing is done that way. The 2024 budget was less than 5%, and we're talking about 15%. So I think a lot needs to be done, because for a budget to be less than 5% in a sector that is essential to the well-being of citizens, to the productivity of the citizens, and to the outcome of wealth of that nation, I think it is time for government to look into the healthcare system and understand that it is worth that 15% at least.
Thank you, Nanman. I was just, as you were talking, I was wondering, so do we leave this to the government? Is there any other way that stakeholders can, should, will come together to work together to ensure that our health system becomes the ideal? Because I know that back in the days, people were actually coming to Nigeria to access healthcare. But today, it is in the reverse. So what do we as stakeholders, civil society organizations, government, agencies, name it, how do we come together to make it happen?
A lot needs to be done. I think we're all stakeholders in this. It is not just government. Government has her role. We, the citizens, have our role. Healthcare managers or leaders or people who are in the helm of affairs of health, like if you're the MD, you're the director, whoever is your, whatever is the title, everybody has a responsibility. To the government, investment in healthcare, like we talked about the budget, it shouldn't be less than 5% like it is being captured in 2024. That 15% that leaders made that commitment, government should look into that. That is one side. Now, in the healthcare sector itself, even if these resources are allocated, how do we monitor this? How do we understand that corruption won't swallow up these resources that entered it? So that's another thing. So who are the managers of healthcare? They have a responsibility to understand, to ensure that resources are maximized. Resources are allocated to where it is supposed to be. Not that the budget says, this is for training. You now carry it and do another thing. Or they say, this is to buy equipment. You now pick it and say, no, we need to build another thing. No. Allocation of resources by people who are managers or people who are in the helm of affairs of the healthcare system matters a lot. Then to we, the healthcare workers, we also have a role. If I am committed to render care, I have a duty of care to my clients, I should do my best. And then how do we educate these patients? I have a responsibility. The healthcare workers have a responsibility to educate the patients, to understand what is happening in the system, what is happening with their own health, and what they need to know, what they need to do part-time. So everybody must be on deck. Now the civil society, now organizations like OTUWA now is campaigning that health is human right, and that is the truth. Health is a human right. And you are calling on government, calling on everybody to take responsibility, and that is the key word. Pressure groups must come up. CSOs must come up and remind government of her responsibility to the citizens of the country, that they owe Nigerians quality healthcare.
Thank you so much, Nanman. It's been a wonderful and insightful conversation with you, and thank you so much for your time.
Thank you.
So, we've heard from the health practitioner herself, and I'm particularly interested in the way forward. She has been able to enumerate certain steps that can be taken by way of going forward to improve our health sector. I'm hoping that the government is listening and all parties involved are listening, and hopefully in the nearest future, Nigerians will be able to smile in terms of access to proper healthcare, affordable healthcare. Thank you so much for joining me. Till next time, my name remains Precious Nat. Bye.